It's not just knowing the anatomy. I mean, dermatologists know the anatomy of the skin.
Yeah.
ENTs know the anatomy of the face. But plastic surgery is so much more than just knowing the anatomy. It's knowing how things work together. It's knowing where blood flow comes from. How do the nerves work? Things of that nature. And what can you do to help give someone back something normal, if it happens to be a trauma, or how can you improve something that's good already and make it even better?
And I think a lot of people don't know that oftentimes we, the plastic surgeons, are the end of the road. In other words, when the other various surgical specialties don't and cannot come up with a solution, we get the call. And I think that was one of the things that I found just wonderful about the specialty, is that there is only so many reconstructive options, and that we, the plastic surgeons, really understand and know what those are. It is not always all glamorous. It is oftentimes exceptionally stressful, but I think the thing that we love about it is really that we have the ability and the training to provide a solution to sometimes problems that seem completely insurmountable.
Makes looking at breast augmentation pretty easy. You know, you think of the anatomy and
Not
how you're going to do
always easy,
it,
but
right?
yes.
But you get in there and you're like, wow, I could do this and really manipulate that tissue and make it look better and work
I think
better.
what you're getting at is really it develops a lot of confidence. It gives you the ability to say, you know, these are some complex things, and even certain patients with a breast reconstruction or facelifts, we're dealing with just very delicate anatomy, but we've been there, we've done that, and we understand. We've seen things that are a lot worse, and we can apply those to the cosmetic side of things. So,
Well, I think when you look at those types of patients and those really difficult problems, there's not a lot that stresses us out anymore.
No.
I mean, it's not that we're operating on the heart or on the brain or something, but with all that said, we face big problems that we're the only ones that can fix it.
And it's the patients that consider it the problem too. You know, when somebody comes in and they have facial laxity or droop from Bell's palsy or something, you know, it mortifies them. And if you can give them with just some simple things or a facelift and recreate those facial symmetries, you can change their world to where they have such a confidence they can go back out and be a part of it, be part of their family and their friends, and it just makes it all that much more rewarding.
One of the most basic procedures that we do is a breast reduction.
Yeah.
And, you know, out of all the patients that we have, some of those patients are the happiest patients that you can imagine, because they go from a life where they're hurting most of the time, they have back pain and neck pain and shoulder pain, and you simply reduce the size of their breasts, give them back a better shape, and it changes their life, because then they're able to exercise again. And I see that a lot in some of the patients who've lost a tremendous amount of weight.
All right.
They have all this extra skin, and yet you take that away and they can get back to a more normal life. They're no longer embarrassed. And more than anything, more than changing appearance, because that's a side effect, the real thing is giving them back their self-esteem, giving them back their confidence, and allowing them to go on with their life.
I mean, you can take the converse of that. There's many women post-pregnancy that have lost a lot of volume, or they were born with very little tissue and just do not feel feminine. And just reestablishing the curves on the body, it does wonders for them. I had recently a patient that she had a tummy tuck, and she had 3 children and thought she would never ever be able to reestablish her form and her shape. And it was the nicest letter and subsequent luncheon she provided for us, but it was basically her comment was that my husband and I never dreamed that I would be able to get back to this kind of shape and form. I keep talking about what makes me tick and what keeps me going. That's definitely it.
The letters that you get, I still have a card to this day of a little girl who had a dog bite on her face, and I came in the middle of the night and sewed up her laceration very carefully, and she subsequently made a card for me where she even drew a picture of herself with the little cut on there. and I still have it because it just has the nicest sentiments. And that's what makes you want to go on.
All of this stuff, all the training that we go through, all of the major reconstructive operations, and how that puts you in a position where you're ready to do some really good cosmetic surgery. That's what it means to be a board-certified plastic surgeon. And that's why we always say every time, you know, when you're looking for somebody for your cosmetic surgery, you're never going to find anybody better than a board-certified plastic surgeon.
I think that's key. I really do.
Absolutely.